Yaka MP regarding the operational of Kalama Sub-County Administrative Unit. D. Question number 249 of 2021 by the Honorable Peris Tobiko MP regarding the rampant theft of livestock in Kajiado East. E. Question number 227 of 2021 by the Honorable Halima Mushege MP regarding the unexplained disappearance of Dennis Kinoti. And F. Question number 244 of 2021 by Honorable William Kamket MP on the removal of police roadblocks along Marigat Shemolingot Road in Tiati constituency. And G. Question number 203 of 2021 by Honorable Omboko Milemba MP regarding the recent incidents of insecurity in Emhaya. Honorable Speaker, the House Business Committee will convene on Tuesday, 10th August 2021 to schedule the business for that week. I now wish to lay this statement on the table of the House. Thank you, Honorable Speaker.
Very well. Next order.
Order number 8, motion, report of the Committee of the Whole House on the Parliamentary Pensions Amendment number 3 Bill, National Assembly Bill number 57 of 2019. Question to be put on third reading.
Honourable members, I put the question, which is that this House do agree with the report of the Committee of the Whole House on its consideration of the Parliamentary Pensions Amendment Bill number 3 Bill, National Assembly Bill number 57 of 2019. Will as many as that opinion say aye? Aye. As many as counter opinion say nay? The ayes have it. Yeah. Goes of chair. Yeah. Move on.
Honourable Speaker, I beg to move that the Parliamentary Pension Amendment number 3, Bill National Assembly Bill number 57 of 2019 be now read a third time. I also request Honorable Teddy Mombire to second.
Member for Ganze.
Mr. Speaker, I do second.
Honourable members, I propose the question, which is that the Parliamentary Pensions Amendment number 3 Bill, National Assembly Bill number 57 of 2019, be now read a third time. Now, members, I now put the question, which is that the Parliamentary Pensions Amendment number 3 Bill, National Assembly Bill number 57 of 2019, be now read a third time. Will as many as of that opinion say aye? Aye. Will as many as of counter opinion say nay? The ayes have it.
A bill for an act of Parliament to amend the Parliamentary Pensions Act and for connected purposes.
Next order.
Order number 9, the Waqf Bill, National Assembly Bill number 73 of 2019, second reading. Question to be put.
Honourable members, debate on this bill was concluded yesterday, and what remained was for the question to be put, which I hereby do. The Waqf Bill, National Assembly Bill number 73 of 2019, be now read a second time. Will as many as of that opinion say aye? Aye. As many as counter opinion say nay? Aye. The ayes have it.
A bill for an act of Parliament to provide for the establishment of the Waqf Commission, to provide for the administration of Waqf property and for connected purposes.
Next order.
Order number 10, the National Hospital Insurance Fund Amendment Bill, National Assembly Bill number 21 of 2021, second reading, resumption of debate.
Who was on the floor? Nobody was on the floor, so all at liberty to. The chair of Health Committee. You have not spoken, eh? Please.
Thank you, Mr. Speaker. Mr. Speaker, I want to really support the NHIF Amendment Bill, the National Assembly Bill number 21 of 2021. Mr. Speaker, and before I give my contribution, I really want to thank all the stakeholders who, after we published on print media on 10th June 2021, requesting for comments on the bill from the members of public and relevant stakeholders pursuant to the provision of Article 118, 1B. We had many stakeholders who came from the Ministry of Health, the NHIF itself, the Kenya Medical Practitioners Board, Dr. Kahura Mundia, the National Gender Equality Commission, Central Organization of Trade Union, Federation of Kenya Employers, British American Insurance Company, Kenya Association of Private Hospitals, and Kenya Union of Nutritionists and Dietitians. Though some others came late, Mr. Speaker, these ones were able to thoroughly go through, and I want to take also this opportunity to thank the members of the committee who burnt the midnight oil to make sure that we were able to handle several amendments that were here, and also the amendments that we have tabled today. Mr. Speaker, this bill seeks to amend the National Hospital Insurance Fund Act of 1998 to establish a national health scheme and to ensure that the mandate and the capacity of the National Hospital Insurance Fund, which is famously known as the NHIF, will facilitate and deliver the universal health coverage. This is one of the big four agenda. And to my colleagues who normally take to the political podiums to say the big four agendas are dead, they need to be in the house at a time like this, because I can't see the yellow as I'd seen it before, to know that we are still pursuing and these agendas are so much alive. Mr. Speaker, please advise them. Mr. Speaker, the government of Kenya adopted the UHC as one of the big four priority agenda, with an aspiration that by 2022, all citizens will have access to quality health care services that they need without getting into financial difficulties. For the government to realize that, and sustain UHC, there is therefore a need for the development and implementation of adequate policy, legal and institutional frameworks, including the transformation and repositioning of the national NHIF as a key driver and a strategic purchaser of healthcare services for Kenyan residents. Among the key recommendations, Mr. Speaker, there is a proposal to reposition NHIF as a key driver for UHC in Kenya in this amendment. The bill proposes one of the concepts that is practiced globally, where the private health insurance is a primary player, while the social health insurer becomes the second player. This will allow the social insurer to cater for the cost of treatment more comprehensively for the vulnerable population in the society with a limited ability to purchase insurance or even health services. And if they thoroughly go through this, then they can understand what bottom-up means. We are taking care of the vulnerable in the society, and so this is not just theoretical, but we are practicing it in this house, not in the next year. Mr. Speaker, some of the critical amendments that we have done in this bill is to propose that employers match the employees' contribution. This was one of the proposals. However, the committee amended this provision due to the tough COVID times that we have, and this would have really heavily affected the private sector. And we propose that the national and county governments to lead and shall be responsible for paying an equal contribution to NHIF in respect to all public officers and state officers. Further, the private employer shall be obligated to top up the employee's contribution who pay the minimum contribution to NHIF to ensure that the cumulative amount for each employee to the fund is not less than 500 shillings. Just to explain to the House is that part of the lower cadre of the employees, because the NHIF, they do calculations per the percentage, we have the lowest paying at 150 shillings, and all the way to the maximum, or the people who earn more than 100,000 to the millions, they pay 1,700 as a contribution. So to make sure that we lift the ones who are down there, which are around 13%, and maybe in the private sector might be around 5%, we have recommended that we actually urge the employer to top up if somebody is paying 150, so that every Kenyan who is now accessing NHIF will be paying 500 shillings. And for the government and both government, county and national government, to actually match the contribution, so that if Parliament, we are limiting our money, we are also able to support the most vulnerable in the society who are not able to pay for NHIF services. And once they get the card, they'll be able to access to the services. Currently, I would want to inform the House that we have already given a budget of 1 million households to be taken care of, and they'll get the card, and they can get, those families will get access to healthcare without pay. We are also concerned about the quality and, of course, the access, and to make sure that even if they get treatment, they'll also get the drugs. So this is a journey that we have started, and we are committed to make sure that it is sustained. The committee also proposed reduction of the penalty for non-remitters or special contribution by self-employed persons from 5 times to 10% of the amount of contribution due. This is necessary so as to ensure a realistic payment of penalties, so that we don't, sometimes the ones who are not able to pay, it's not that they were not willing. They may not have had the money. And this has happened even to even some of our contribution, even in this Parliament, when our staff will delay the payment. Hence, the penalties that was given 5 times was really not favorable, especially to the most vulnerable in the community. As to the non-remittance by the contributor, may be occasioned by lack of funds, occasioned by lack of income. The amendment further seeks to eliminate the double penalty for non-remittance. Committee also proposed an amendment to allow for a provision of voluntary contribution to be made by the youth, so as to ensure that any youth who may not have a stable source of income but wishes to make a contribution to the fund is allowed to do so. And this one I would want to really explain about it, because the NHIF, if somebody is under their parents by now the age of 21, you're not covered by your parents. And remember, the 500 shillings that is voluntary, it covers both if both parents are there and the siblings who are below the age of 21. But our young people, even the ones who are in the university, if they would wish to make a contribution to NHIF, they are still forced to pay the 500 shillings. There is no consideration of a youth. And as we know, the definition of a youth, anyone who is between the age of 18 and 35. So we have tasked NHIF to come up with an amount, and hopefully maybe around 200 shillings, where one can pay per month and they'll be able to access to the services. The bill proposes that households with the ability to pay must contribute to the kitty. However, for those unable to pay, the national and county governments will step in and pay. Approximately 20% of the 5.1 million poor and vulnerable households have been identified across all the 47 counties. Finally, to reduce the turnaround time in service delivery and deter fraudulent activities, the bill proposes complete digitalization of the NHIF process. So as I wind up, I would want to say I support, and as I thank my colleagues, I want to urge this House, as we debate, we support these amendments so that the issue of UAT can become a reality. And we have done several NHIF reforms where there was a lot of frauds. Now things are now in order, and we are hopeful that all Kenyans will now finally enjoy UAT services. I thank you, Mr. Speaker.
The Honorable Sheikh Mohammed, member for Wajir South.
Thank you very much, Mr. Speaker. Mr. Speaker, I stand to support the amendment that we have considered in the Health Committee on the matter of looking at Bill number 21 of 2021. And I do support for various reasons, and some of these reasons are quite compelling. I call them compelling because I see that public health insurance is the cornerstone of society, the cornerstone of the health of communities across the world. It is not a new thing for us. It has been here for many years, particularly NHIF that's been here. Although it used to be called National Hospital Insurance Fund, it is currently called National Health Insurance Fund. And if you can look at that particular point, the term health is a very important point that can raise the situation that it is no longer about hospital. It is about healthcare. It is about looking at the health of our community, wholesomely, whether it be physiotherapy, be it be radiotherapy, be it be direct medical intervention. and medical admissions in hospitals as well. Therefore, that is the reason as to why it is currently called, or even psychotherapy and psychology and many other things that are outside the hospital vicinity sometimes, that could be utilized in other various institutions that specialize in those particular areas. And therefore, that is the main reason as to why it carries the term health. And therefore, that gives a prerogative to which that it can stand across various disciplines within the health service or the health of the individual. Now, this bill has gone through public participation, and that public participation was not necessarily individuals that were coming to contribute to the reasoning as to why this amendment is necessary, but it is also about the shoe wearer. The shoe wearer could be the individuals, that particular patient that can utilize that doctor that uses this to ensure that the patients are covered, that hospital that will ensure that it has delivered the service and it is paid accordingly. And therefore, we have engaged these public individuals and private individuals to be able to come and tell us that. But NHIF, for me, I joined on the 24th of March 1993, by the way, and therefore that is a long time ago, and that's what my card is showing. That means that this is a service that has been providing services for many years, even way before me, and therefore to amend, to change, to carry on the day, as things change by, is very necessary, Mr. Speaker. Now, quality of health care is a universal human right, for one and for all. That is, an important thing that is required by everybody across the world. So it is a fundamental human right that we can get access to healthcare service. And therefore, for us to get that, it means that there has to be a funding body, a body that pools fund to be able to be utilized by individuals that, fall ill and require that service. But the particular reasoning as to why we were making these changes, or these amendments rather, is because equitable health services must be obtained by everybody if we are looking at the human rights of everyone. And what I mean by that is to say that the poor and the rich can be able to access that pool of fund so that they can utilize that pool of fund at the time of need, at the hour of need, at the period of need, for themselves and for their loved ones. And therefore, unless we have got these checks and balances that are put together to ensure that this is universally provided to the poor and the rich equitably, then we will not be able to achieve that universal human right that I have begun my statement with. Mr. Speaker, the point that we really looked at and dug into, and I really argued in my discussions and debates on the time that we were processing these amendments, is that, you see, there are public workers, and those are the ones that work in public institutions and public governments. Government institutions, that is. And those private workers that work in private industry, in the hotel industry, in various other industries, that is. These are the two types of workers. Now, if the government is giving a particular amount of money, whether be it be the county government, be it be the national government, if it is adding up a particular amount, then why not the private workers being given also, a substantial amount? And we have pegged that to about 500 shillings at least, at the minimum, where we can be able to be saying that every worker must be getting at that minimum to be able to be given the opportunity to be able to get that. Now, it will be unfair. It will be unfair for a public worker, and I want to use a single example. It will be unfair for a teacher to be getting the best services, and for an industry worker or a hotel worker to be getting, a lesser amount of service. What that means is that if someone is given a service of 150,000, equivalent to 150,000 shillings, then, and that is a public worker or someone working for the government, then the one who is working in private should be able to get that, not any less than that. And that is where that uniformity, that universal, human right comes in now here. So we said that it must be reaching within that bar. Now, We are also trying to see that this bill repositions NHIF as the driver of UHC. UHC is one of the cornerstones of this government's decision to make sure that healthcare is an important element that the Uhuru government wants to find that it has left as a legacy. And that is why we want to say, if we strengthen and support the process that NHIF takes to be able to contribute to the healthcare of our society, then it means that we must be able to support this through UHC. And that is why it is important. Although to my mind, UHC is universal health coverage. For me, I would like to call it UHC, universal health care. And when I say universal health care, and this, I debated so much about it, the word coverage is not very important to me, simply because it has been used. That is why I have to live with it. But I would rather say universal health coverage, universal health care, where actually I include the bedside nurse, I include the public health technician, I include the doctors, and these are the people to be done, rather than a plastic card to be called a coverage. That debate will be on another day, but I really wanted to mention that on it. The unemployed and the vulnerable will have been taken care of in this place, where actually individuals were given an independent prerogative to be able to, contribute to this scheme. Reduction of penalty was one of the other things that was quite advantageous that we saw looking at this bill to be able to contribute to the communities and societies that are actually at the peril of poverty. And when I say peril of poverty, I am trying to indicate that there are people who have been actually challenged by life through unemployment for a very long time, or have never been employed in their lifetime, or may never get employed because of their age and where they are, and therefore, and where they are in this country, that's in the far rural areas. And therefore we have said that there should be no penalties. That is going to be too much for everybody. What that means is that we have reduced the penalty to about 5%, rather than looking at beyond that. Therefore, these are some of the things that we have looked at that. Now, this amendment states a cut-off of the contribution, the 500 shillings that I've said that, so I need not to repeat on it. Now, the growth of our public and private institutions, or healthcare sector that is going to be enhanced when we have got more pool of resources that can be accessed by public, by everybody, by every Kenyan. It means that public and private institutions will be working hand in hand, will also be able to provide the similar services so that they can compete for that pool, so that we can create a competitive health sector, both from private and from public. And therefore that is very important. So it actually affirms better performance of the health sector industry, be they be public, be they be private. And therefore NHIF will be required to be able to be looking at the best of services provided to the patients, to their clientele, is what we are looking at. Excuse me. Means testing. Means testing is a very important thing. I would have suggested that to be included into this. The reason why I'm saying means tested is that there are people who are quite poor. There are people who earn a small amount of salaries, and therefore those salaries may not be sufficient enough for their other livelihood, and therefore healthcare becomes a third option for them. Now, we want to discourage that. We want healthcare to become the first option for everybody, and through that we look at the means testing. We say that individuals can only pay this amount where they are required to be able to sustain themselves in accessing the healthcare. And that is where now we're going back to the aspect of the UHC, or universal health coverage. But before I end here, Mr. Speaker, we can borrow leave from other Commonwealth countries, like the United Kingdom, like Australia, New Zealand. These are areas that I have worked in, and I have seen that universal health coverage is a very, very important aspect for everybody. There is the Medicare levy, for example, in Australia, where actually 47% of the Commonwealth budget of health goes to Medicare. And Medicare is kind of an insurance pool where actually everybody is covered through that. For those that are having higher income, may go for private health insurance, or may contribute another.
The Honorable Soshan.
Thank you.
Thank you, Honorable Speaker. I rise to support the NHIF Health Amendment Bill 2021. And from the report of the Health Committee, this indeed is part of the alignment of the health sector to the implementation of the Big Four agenda. One of the key Big Four agenda is the healthcare system. Mr. Speaker, since inception of NHIF in this country in 1966, it has basically served the interest of Kenyans who are actively employed in various sectors and are able to statutorily contribute to the scheme. And the fact of the matter is that millions of Kenyan population are unable to meet their healthcare needs. And of course, the active debate to ensure that all citizens are brought on board is noble. Mr. Speaker, sir, as Kenya aspires to be a middle-income country, it cannot be without ensuring that its population is healthy, and not just healthy. The healthcare system is strong and delivering. That is one of the key indicators of any economy that aspires to improve the livelihoods of citizens. The healthcare of households really would be very critical. And Mr. Speaker, through this amendment, a number of issues have indeed been addressed. One being the management of the fund. Honorable Speaker, with experience of working with the fund, we have witnessed several challenges of the fund over the years, and I believe this is what the fund seeks to address. And one is the management. It is another thing to fund the fund, and it is also another huge, completely different business to ensure that the fund is managed well. And therefore, stating the minimum qualifications of the CEO and the general structure of the fund is good, because at the end of the day, it's the leadership of the fund that will deliver the intended services. Mr. Speaker, the other key challenge, we cannot talk about universal health coverage. It is easier said to talk about the Big Four, while the key aspect of driving the fund is not addressed, and that is basically funding. The key thing is funding. Currently, NHIF, and we cannot, all the Big Four is about funding. We get the fund and manage it well, then we definitely will deliver. And I would like to concentrate on the funding. With experience of working with NHIF and, of course, the approach of government, it must address the aspect of funding. The NHIF, if it is intended to cover the entire Kenyans, those indeed who can contribute through statutory deductions, through voluntary contributions, this bill should enable them to actually do so mandatorily. Mr. Speaker, we cannot have a UHC if it doesn't cover all Kenyans. The last category of Kenyans that are unable to pay what we call the indigents is what the government must finance. And therefore, Mr. Speaker, it has to be very clear that in every annual budget, the government must be very clear about the funding to the indigents. The number must be known. The allocation per person must be known. So that really, it is not just a participation of contributors, of workers and voluntary contributors. We risk overburdening the fund by rolling in indigents who are not properly covered. So indeed, Mr. Speaker, in the bill, for the first time, it's mentioning government financing to support the indigents, but it will be necessary to move forward at the implementation level, now that there is a piece of legislation, so that Treasury can always set aside funds to cover the indigents. If this is done, then all Kenyans indeed will be covered through the through the universal health coverage system. And indeed, the name has changed from National Hospital Insurance Fund to National Health Insurance Scheme. Being a scheme, it means all Kenyans are invited. And I caution that the role of government must be made clear, and particularly the role of government in funding, and funding particularly the indigents who have been mapped out. Honorable Speaker, we've destroyed institutions in this country through mismanagement. And the history of NHIF is clear. It has been one of the greatest victims of corruption in terms of mismanagement, and is also a greatest source of wastage of funds. And hopefully, through prudent management, a responsible CEO, and a responsible board of management, the operation cost of the fund should be rationalized. Most of the resources collected or the funding channel to NHIF goes into operation and employment. And there is need to restructure and review the operations of NHIF in terms of human resource so that you reduce the cost of expenditure in payment of salaries and other operations, so that most of the money can directly go to the funding of the citizens. And finally, Mr. Speaker, health services are procured from good and well-equipped and well-supported healthcare facilities. This is one area that the government cannot avoid in ensuring that even in partnering with the private entrepreneurs, our public healthcare systems should be one of the best. We cannot talk of an insurance scheme without ensuring that we've got state-of-the-art healthcare facilities. And of course, examples have been given in many countries. There are many models that different civilizations and democracies do follow. And when I recall the Malaysian system of health care, the point of success is quality health care facilities, to the extent that in a country like Malaysia, you hardly can find a private health care facilities, because all the existing healthcare facilities are public, well managed, and well funded, to the extent that almost all the citizens, regardless of status and class in the society, can be attended. And I think other than developing a universal health care scheme, we must also upgrade and ensure that our health care facilities, particularly public, are of good quality, with adequate drugs, adequate personnel, and good management. Honorable Speaker, I support this amendment. It's progressive, and it's going to take this country truly to the achievement of universal healthcare system if it is properly managed and properly supervised. Thank you, Honorable Speaker.
The Honorable Session, I agree with you that it is serious, it is imperative that the public facilities in health must be the number one in providing this universal health care. I think it is a misnomer, really, where the private is perceived to be better than the public. The public, in providing health care, must be the number one goal of any serious government. I agree with you. The Honorable Tutwek Cameron, member for Mogotia. Tutwek, member for Mogotia? He's not in at the moment. We shall then have the Honorable Milemba Omboko, member for Emuhaya.
Thank you, Honorable Speaker, for this chance to make just a few comments on this bill that concerns NHIF and health cover, Honorable Speaker. Honorable Speaker, health is so fundamental, especially we having gone through the COVID period, where we realized that the strength of the national health system is extremely very important, because nobody was able to move from our country or even just any other country to another to get health care. And even as we stand today, it remains vital under realization to all the communities of the world that a universal health system is important, and therefore the public facilities within the Ministry of Health or within the healthcare are very vital. Honorable Speaker, this is generally a holistic, very good bill, because it tries now to expand the healthcare system to reach out to every Kenyan so that everybody will benefit. Honorable Speaker, however, I would wish just to raise a few issues which again could help to make even the bill stronger. But the National Hospital Insurance Fund was established long back by the workers. It's just the workers who actually established this National Hospital Insurance Fund. And it was formalized in 1966, I think, by an act of Parliament which was Cap 255 of the laws of Kenya. And we have moved with it such that with the formalization, it was able to provide health care insurance, including to those in the informal sector. Because originally the workers who founded this scheme, this fund, the National Hospital Insurance Fund, were those who were salaried. The core mandate, Honorable Speaker, was basically to provide insurance cover to members. Later on, Honorable Speaker, the fund was also changed using a law which allowed all other people to participate, and at a minimum of 500, which we were told very clearly by the chair of the Health Committee. And this is ongoing. Later on, Honorable Speaker, the government included other players within this fund, like the students who are now enjoying the coverage from the National Hospital Insurance Fund, together with the Linda Mama program, which is also within the scheme. So I think these were the early attempts to start expanding this scheme. Honorable Speaker, as a matter of fact, it is true that the National Hospital Insurance Fund has about 10 million members countrywide, or about 10.4 million members. But of these members, Honorable Speaker, because we've been very close to this particular fund, coming from the background of the teachers, only 5 million are active. The other 5 million are not very active for reasons not known, but I'm sure that the committee will be looking at this so that as we expand it, we also are sure that we shall make it stronger and not possibly just lay it bare to everybody, finally leading to possibly vulgarization of the fund. Honorable Speaker, the NHS, the National Hospital Insurance Fund, as it is today, has so many assets also, some which were founded by the workers themselves. And the direction then we are taking, I hope at the level of the third reading, we shall be able to address the issue of its assets, and also the fact that where will be the place of the workers, who are the main contributors to this particular fund. Because by opening it completely, if the government does not send, it's part of what is required to send, especially the funds that are meant for the indigent. Because in this bill, they talk about the indigents who will benefit from this particular fund, and these indigents, the government will be liable to pay for them. The bill does not clearly define how we shall identify the indigents countrywide, but above all, should the government not send funds, like the earlier speaker did say, given the history we have of how funding has been done, not only in a situation like this, but even just the CDF which we are managing, then there's a risk that there will be too much pressure on the co-contributors of this particular fund who are workers of Kenya. And if we don't take good care, the fund could actually collapse. And indeed, I heard Honorable Association did mention that we have had many institutions in this country which have failed because of a system that almost borders nationalization. Because when you look at this particular bill, it opens it up completely and nationalizes the National Hospital Insurance Fund. But unless managed well, unless the government sends funds for the indigent, unless the government sends funds to this particular organization for the vulnerable, because the vulnerable are also mentioned here, then yes, very good law, but finally the co-contributors, who are just about 5 million, may likely realize that the services of this particular fund will not be good for them, and we may also end up just collapsing the entire fund after all. Honorable Speaker, there are also good examples which I would wish the committee looks at. Especially they could look at a good example of Britain with its national health system, which is working with a membership of more than 1.3 million members and with a budget of over 90 billion pounds. That may look foreign, because when you look at the example of Britain, and you could also compare with Rwanda, because Rwanda, after the genocide, did build a very strong health system. And when you look at the two, you may notice that the government still has a chance of organizing such a fund without necessarily dealing with the National Hospital Insurance Fund. Though I also know that the National Hospital Insurance Fund would be a stepping stone upon which the government could take off to go and get universal health care. Because, Honorable Speaker, further facts are that of all the health insurance schemes in this country, and there are about 32 or 33, they only take care of 1% of the health insurance in the country, and National Hospital Insurance Fund takes about 16%, because only about 19% of the Kenyans are enjoying this kind of insurance. So I would want that possibly when we shall be looking at the third reading, we look at all these facts and see how we can make sure that, yes, the expanded National Hospital Insurance Fund will be stronger, will be more stable, and will provide the requirements that we really want it to get without interfering and finally possibly vulgarizing and ending the existence of the National Hospital Insurance Fund after all. If you go back into history, many of such organizations have gone down, and currently as workers we boast of only two remaining, the National Hospital Insurance Fund and the NSSF. And that's now where we are, so I want to put a word of caution to that extent. Honorable Speaker, I think with those very, very few remarks, I would wish to support the bill, but look forward that in the third reading we shall be able to put in some amendments which can protect the interest of the co-funders who are the workers, and possibly even cadre the insurance scheme so that it will operate at different cadres for different contributors graduated in order of their contributions. Thank you, Honorable Speaker.
The Honorable Wanga, what is burning? The member for Homa Bay.
Thank you, Honorable Speaker. Honorable Speaker, I rise to support this amendment bill. Honorable Speaker, the NHIF amendment bill. Honorable Speaker, COVID-19 pandemic has really exposed the failures and challenges of our health system, because all of us, no matter whether you would otherwise get the best health care in this country and abroad, First of all, it confined everybody to the country, so there is no moving out of the country to go and seek health care anywhere else. Secondly, if COVID catches up with you in the heart of Homa Bay County somewhere, there would be no time to take you elsewhere. So it has really exposed the need for us to strengthen our healthcare system and the failures of the current system and ways through which we can actually strengthen it. Honorable Speaker, despite the fact that the 2010 Constitution gives every Kenyan a right to the highest attainable standard of healthcare, it is still a far cry. It's a far dream. And that is the reason why, if we are amending the NHIF Act to ensure that every Kenyan above the age of 18 is a member of the NHIF compulsorily, then it should be supported. Compulsory health insurance is an idea whose time has come. And like French poet Victor Hugo said, there's nothing more powerful than idea whose time has come. But Honorable Speaker, as I support this bill, and from the Finance Committee perspective, we deal with matters of insurance and how secure Kenyans' monies are within the insurance sector. So, Honorable Speaker, as you look at NHIF becoming a compulsory fund and everybody putting in their money, we must also think about NHIF possibly becoming a victim of its growth and success. Because when we make it compulsory, the amount of money that is going to go into NHIF as far as contributions is concerned is going to be humongous. The growth, and I'm sure the Health Committee, when they were doing review of this bill, probably looked into just how much NHIF is going to grow as soon as this bill is passed. So what mechanisms are we putting in place to ensure that Kenyans' funds are secure within the NHIF structure? And Honorable Speaker, there is an age-old principle in insurance, the principle of risk spreading. So this bill must take into consideration the principle of risk spreading. We must look at ways through which NHIF can spread the risk and deal with the possibility of what is going to come upon it. Because, Honorable Speaker, you're going to be having possibly very high claims. You're possibly going to be having very increased instances of fraudulent claims and high chances of depleting the funds savings as a result of these increased claims. So, Honorable Speaker, one of the things that I'm going to be proposing possibly as we go to the third reading is how we can spread risk. Are we going to consider, for example, reinsurance as a way of spreading the risk? So that as we put our money into NHIF, it's not that if NHIF comes down, we have nowhere to fall back. Because reinsurance is insurance of insurance. So that as we move forward, we are not closing our eyes to the fact that there is a possibility that the portfolios within NHIF are subject to, abuse and so on. So, Honorable Speaker, the issue of reinsurance should be considered. The issue of partnerships should be considered. The issue of investment in ICT. Because when you are now going to manage the kind of portfolio that NHIF is going to manage, we must invest in top of the range ICT so that we are not back to carrying, forms or cards. And that's why I'm happy that NHIF is doing biometric registration so that when you arrive at the hospital, you just put your finger. Governance issues must be looked at in a big way, Honorable Speaker. So I just wanted to say that from a finance committee perspective, we should look at the issue of securing this exponential growth within NHIF. We must consider reinsurance. We must consider partnerships that will strengthen governance and management at NHIF. We must very much consider risk spreading so that we are not in a situation where if NHIF goes down, everything goes down with it. I thank you, Honorable Speaker, and I beg to support.
The Honorable Russell, Member for Sako.
Thank you very much, Honorable Speaker. Honorable Speaker, I rise to support this bill, and I want to thank our Committee of Health for coming up with what I consider to be formidable. Living in Kenya, NHIF is actually like the last frontier. We as members of Parliament, when we go to our constituencies, we are normally faced by two tasks. One is a parent coming to talk to you about education, and the second one is health. And the health one is such a mind-boggling thing, where somebody comes to you that they have somebody in the hospital and they have run a bill of 4 or 5 million. Or even a very poor family that has run a bill of 300,000. So on many occasions, what I have come to realize, NHIF has come to the aid of many of us and of those many families that take their loved one to the hospital. Honorable Speaker, the reason why we are celebrating NHIF is because our health system has actually crashed. It is like it is there and it is not there. It is there for those who have money, those who have resources, those who can put a logbook or even a title deed to secure their treatment. But for the many who do not have jobs or who are in the lowest paid job, who are hustling, this particular scheme comes in handy all the time. Mr. Speaker, more than at any time in the history of our country, health is going to become a premium area of concern to the citizenry of this country. Going forward, the needs for health, the requirement for health services actually is not going to go down. It is going to go up and escalate all the time. And sometimes I like the contribution of former PS, like our MP there. Because during their time, the health system was not devolved. They were able to control the levers from the center. They managed to an extent. But I think with devolution, we are actually seeing all the holes. The doctors tend to go in one direction. They tend to go to the private hospitals. The many outlying regions that do not have local staff, actually they end up taking their patients to the central areas. Today in Marsabit, a lot of work has been done through the devolved unit. But still, most of our patients end up in Meru, Nyeri, Embu or Nairobi for specialized treatment or to meet the specialist, because many of the special fields in medicine are not available locally. Mr. Speaker, I want to borrow the words of the last honorable member, Wanga, who spoke before me, that if we really want a healthy nation that must try to create wealth, the NHIF scheme should be compulsory to every young person above the age of 18. Just like above the age of 18, you are entitled to an ID card. Then, when things happen and you flash out that NHIF card, once an accident happens or somebody gets sick, then the nearest hospital becomes the rescue center for every individual in this country. Honorable Speaker, I like this bill, but this bill, the way it has been built, is to make the NHIF efficient, sustainable, available, accessible, and all that. But what we are not saying is how do we invest in our health system? Because NHIF, at the end of the day, becomes a governmental organization or a parastatal that sits aside. What the bill or the crafters of the bill should attempt to do is, in the long run, can NHIF become the umbrella for organizing the Kenyan health system, so that the government must invest in it. Money from the national treasury should be put in the health system, so that we don't see NHIF as just another parastatal that people are going to loot, but it becomes like the British system, the Australian system, or a bit of the American system. The danger which we are running into, because as honorable member ensured, but majority of our population cannot afford to join any insurance scheme. So for that reason, to remove burden of the citizenry from leadership, from those who have, so that everybody can carry their burden, is for us to invest into a system that eventually will take care of the whole. Honorable Speaker, going forward, any system that we craft where public money goes in, there must be efficiency, there must be prudent management, there should be no theft, corruption, or people who prey on that organization for thrift business. Because one of the reasons any system that is associated with government, people say ni mali ya umma, that it belongs to nobody. But for us, I think if we come up with this bill and this House agrees with it, is to make sure that the NHIF should not become a system that is always bailed out, like what happens with organizations like Kenya Airways. We call it the pride of Africa. Many of us who like to fly Kenya Airways, it doesn't matter what other airlines fly out of Nairobi or out of Kenya. But the question is, where does that investment go? Where does our money go? Honorable Speaker, with those remarks, I want to say that just like Safaricom advertises to get money, or there must be a deliberate effort for the NHIF to go out there to Kenyans to tell them, please join, please become a member. Let us save our lives, let us save lives. With those remarks, I beg to support.
Honorable Raso, you're on to a good thing. We shall now have contribution from the Honorable Adagala, member for Vihiga.
Thank you, Mr. Speaker, sir, for giving me also this chance to also air my views concerning this bill, the NHIF amendment bill. I wish to say this, Mr. Speaker, sir. The health institutions in this country are in a terrible mess, and especially in the county where I come from, where most of the people cannot afford to pay for medical services. People cannot afford to go to hospitals. And even if the hospitals are there, their medicines are not in. Mr. Speaker, this amendment is noble. It has to be made because I know members here will bear witness. People in the villages are suffering, and especially this period of COVID-19. There are so many WhatsApp groups that have been opened, and all of them is in need of medical bills, which is actually a big problem, and I know most members can concur with that, unless it's just in my area, in my county where all this is happening. I wish to ask the NHIF management, as a honorable member has said here, they should be aggressive like other organizations do marketing. Apart from members' contributions, they should also be aggressive to get other members to join. Let this NHIF, since it's the savior of most of us and most of our people, to be a vibrant institution. They have to do marketing to ensure that many members can join this fund, so that it can assist most of the people of this country in hospital bills, which are too much, too overwhelming. We've seen cases of somebody's bill going as far as up to over 2 million. Now that person has a point of an acre. You wonder whether that person will sell to ensure that he pays, or she or he pays the bills. And especially right now during this COVID time, NHIF is not catering for this kind of bills. The Kenyans are suffering. Mr. Speaker, sir, we have to enhance, the government should see other ways of enhancing Kenyan medical bills. For example, this one, the one that is coming up, whereby the indigents are being identified on how they can be covered on the universal health coverage. Mr. Speaker, that one needs to be done right from the villages. These are organizing of such, or getting the indigents should be done by members of parliament who are actually down, who know who are these needy peoples in their various constituencies and counties. So, Mr. Speaker, I would actually support this amendment on this bill, and even any other further amendments should be done to ensure that the contributors and the people who are not contributing, they should be able to benefit from this fund. And also, corruption is also rampant in this country. Let people's money that has been contributed towards this NHIF not to be embezzled. It should do the work that is being submitted for. It should be taken care of very well to ensure that the people of Kenya enjoy health facilities, they're given proper treatment, drugs, not just people going to hospitals that they can't afford. And when they are there, they are given a lot of nothing, no medication, no nothing. And especially there's an hospital, there's a case from my county, which most of you have seen on media going on. And I would wish to tell that family, the Mwenesi family in North Maragoli, Kibagala, sorry for the loss of their person. And she was a nurse, a medical person being mishandled in a hospital facility. Mr. Speaker, there is something that we need to do. There is a problem in the health sector which the government has to fast track, and especially this universal coverage health, it has to be worked on very fast so that Kenyans don't suffer. Our people are suffering. Something has to be done, Mr. Speaker, sir. This bill has come at the right time. I've seen members, honorable members, saying that we need to do an amendment on some of the issues that are supposed to be put in. And this bill has to be fast-tracked so that we pass it for our people to benefit. Therefore, Mr. Speaker, thank you very much. I support.
The Honorable Fukose.
Thank you, Honorable Speaker, for allowing me to contribute to this very important amendment, the National Health Insurance Fund Amendment Bill. Honorable Speaker, on the onset, I want to support this bill. But, Honorable Speaker, you know, when Jubilee in its second term came up with the 4 agendas to which to implement, universal health care was one of those that was anchored. In 2019, a pilot project was started in Nyeri, Machakos, Isiolo, and Kisumu, targeting a population of 3.2 million Kenyans, in which the government intended to be able to roll out this program. But we know what happened after that. And it's unfortunately, Honorable Speaker, that out of that pilot project, you know, the chair was speaking that the Big 4 agenda is now continuing. But out of that pilot project, we expected that the program would be rolled all over the country. But unfortunately, on November 2020, the pilot project came to an end. That was under Cabinet Secretary Cecily Kariuki. And after that, this program was never rolled anywhere. And we cannot be able to ask ourselves, what did we achieve from that pilot project? Because I saw the other time when the governor for Nyeri, Mutahi Kahiga, was complaining and saying they are more worse than when the pilot project started, because with them they expected to register up to 750,000 people in Nyeri into the NHIF. But the numbers dwindled and people continued now, all hoping that there was free service that was going to be provided by the government. But unfortunately, that program came to an end. And nobody went back to even look at what achievements did we achieve from the pilot project that we were able to roll out within those 4 counties. Honorable Speaker, in this amendment, the committee is even proposing that on the penalty, that the penalty be reduced from 5 times to 10%. To me, I would have expected the committee that there should be no penalty, especially during these hard times of COVID-19. Why should there be a penalty? Because if you have people who are paying through their hard-earned money and somebody loses a job, once this person loses a job, is not able to make contributions to NHIF, this person goes and is looking for money, and later on after maybe 2 months or so, rejoins NHIF because they feels the need for having NHIF. Why should we punish that person? Why should we punish? So there should be no punishment for rejoining NHIF, and therefore that fine, I think, should be deleted altogether. When we say that the Mama Mbogas, the Boda Bodas, this team of what we call in our movement, the Hustler Nation, that they should be able to pay 500 per month. I saw Dr. Peter Kamunyo, the CEO NHIF, the other day complaining and saying, we have a huge number of those people who are now defaulting, and they mainly pay during when people want to get treatment. Once they have gotten treatment, which are worth millions of money or thousands of money, then this person decides to not to continue contributing. After the person has been treated, is paid NHIF, goes away home, and does not understand why I should be paying 500. Why can't we review as Parliament and say, let this team of the Mama Mbogas, the Boda Bodas, this hustler team, why can't they pay 300 shillings per month? Why can't we reduce it from 500 to 300 so that we have a huge bracket? And I'm sure that if we reduce that amount to 300, we will get a bigger number of people entering into that NHIF, and defaulting will be reduced. So I think I would really urge the committee that for us to be able to catch a bigger number of people into the NHIF so that we have contributors who are consistent and non-defaulters, why can't we reduce the amount to 300 shillings so that will make it more affordable, more accessible to more Kenyans? The other issue which I would want us to address on this amendment is that NHIF in this era of COVID, and these reforms which we are doing on NHIF, I think they should also be able to, the initial pilot project was to look at the primary health care. How does NHIF support primary health care? Because that is where the biggest problem is. Because if we have a huge number of prevention of people getting diseases, then instead of us just thinking of treatment, why can't we think of prevention cases? How do we use NHIF to maybe have methods, have NHIF supported to provide services?
The Honorable Pukosa, just hold on. The Honorable Kevin Wanyonyi, what is out of order?
I think it's a matter of information. I know Honorable Bokose is a member of the Health Committee. And in the proposal amendment, I think the proposal was talking about 100 shillings to 150. Now, for the youth and the vulnerable groups, I don't know whether I'm out of the information, but I think can you expound on that?
The Honorable Wanyonyi, you are out of order. Proceed, the Honorable Pukosi.
And the Honorable Kevin Ferdinand Wanyonyi, the member for Kwanza, is my neighbor, and I'm not a member of the Health Committee. Yes, apparently you know that most of us who are in the Tanga movement, we were de-whipped from even some committees and taken to where none exist. That is beside the point. I know Mbui, next you'll be de-whipped from being deputy minority leader. That's besides it. You already gotten your gratuity. Anyway, Mr. Speaker, what I was saying is that we need to look at NHIF, its role that it can play also in primary health care, especially in sensitization of Kenyans on preventable diseases, lifestyle diseases. Where does NHIF come in? As much as we look also into that, can we also, I would also ask the committee, I don't know, when we do amendments and do reforms in NHIF. It should also go with reforms in KEMSA, because that is the supply chain for the hospitals. Because you are getting drugs from KEMSA, NHIF is paying, and you know we must be able to make sure that these government institutions are also working. My friend Dr. Nyikal will say that during many times it was better to be admitted in government hospitals than it is today, because things were working in government institutions. Even during my training, things were working better in Kenyatta National Hospital. I can remember that. So government institutions have all the best services. They have the best brains. They have all the consultants. They think the only thing is that we reform and make sure that they are getting the necessary support, the necessary equipment to perform their duties. With those few remarks, Honorable Speaker, I support the amendment. Thank you.
The Honorable Nyikal.
Thank you, Mr. Speaker. I rise to support this NHIF amendment bill. Mr. Speaker, the purpose of this bill is basically to mandate NHIF and give it the structures to deliver universal health cover. And universal health cover means that all citizens can get care which they can afford. And it can either be done, if the government has enough money, just put the money out there and treat people. And that is all. That is what they do in Britain with the NHS system. Since we don't have enough money, we have resolved as a country that we are going to use social health insurance as a means of delivering universal health cover. And this bill, most of the amendments, the main parts of the amendments are doing just that. And what are the components of universal health cover if it is based on insurance? One, you have to pool the funds. Money must come from somewhere. And that's what we are looking at NHIF to do. Having got the money, then you have to design what services are people going to get, the basic benefit package that meets the health cover. Then you have to say who is going to provide this service. And then you say how is this payment going to be made? In this case, if you're using NHIF, NHIF pulls the money, we decide what people are to be given, who is to give it, and NHIF pays. So how is this bill addressing that? First one is actually pooling, getting as much money in NHIF as possible. And if you look at, there's a clause like clause 11, which now inserts another section 15A. It makes it mandatory that every Kenyan above 18 years of age makes a contribution to NHIF. That is the first main thing that comes. The next one, it also provides that employers, what is happening in NHIF now, employers are just collecting money from employees and forwarding it to NHIF. It was also proposing that employers also make a matching contribution, but that has met a lot of opposition, particularly from the employers, and that's something the committee is actually going to make some amendments so that we don't push the employers too far at this time of COVID. The other provision that it is making, if you say everybody is going to pay, obviously there are people who cannot pay. So these are the indigents. So what this bill is doing in that clause 10, it is providing that the national government will pay for the indigents who will be identified by relevant government body. And I would appeal to my colleagues that this is going to be extremely important. Some people are going to be identified because they are unable to pay, and the government is going to pay for them. The process and how that is done is going to be extremely important. It is left to the board, but it's extremely important. In the committee, we felt that this is an area where members of parliament at the constituency level should actually take part on who is identified as indigent and paid for by the government. You see what we have done with the cash transfers of the old persons and orphans and vulnerable people and people with disability. There's been a problem of who is identifying them. So that some people get in there who need not get there. So that's also going to be an extremely important part for the board. The law cannot go into those details, but that is going to be extremely important. So having now got that money, if everybody is going to pay, and those who cannot be paid for the government is paying, we are definitely going to get a lot of money to NHIF. And if the employees also start to pay, and that in my view should be done gradually. Eventually, employers must match what the employees are paying. That can be done gradually over time. The bill also makes amendments so that there was before voluntary contribution, and that is what Honorable Kosi was referring to, people who pay voluntarily 5. And the problem is they do what is called adverse selection. People pay when they are sick. And in the concept of insurance, it is like insuring your car when it already has an accident. Yeah, that is exactly what paying when you are sick is. And actually there's been evidence that people who are making voluntary payment are taking a lot more money out of NHIF than they're putting in. So that actually is removed and indigents are taken care of. I think it's a good way to go. But when we get this big pool of money in NHIF, a big problem of management. There have been efforts to actually reform NHIF. You know, if there's a lot of meat, there'll be a lot of flies. So we have to really work on the management and look at ways of stopping graft, ways of stopping fraud. Efforts have been made to do that. Now we have the money. We are managing it well. But then we have to decide, what are our people going to get? What services? The benefit package. Right now in NHIF, Mr. Speaker, what is happening, we have very many benefit packages. Some are financed differently. We can do MRIs, we can do surgery in some cases, but we can do dialysis in some cases, in some conditions. There is even money we are pulling from the civil servants, we are pulling from, but all that is making the whole thing complex. We can even take people abroad. It is making the whole thing very complex to manage. And therefore, it will be important that we get a proper benefit package that is clear, that is easy to manage, and efforts are there to actually work on that.
Mukia. Mudu ya kwanza bokaleta keti akazitakiwa. Mudu ya pili akazitakiwa. Sasa mumeleta ya huyu mtoto amepatia mzee mimba.
Wewe ulikuwa na kesi hapa?
Nikisema kwamba sijai kuona naweza kuwa nasema rongo.
Bwana, si ulikuja na ukabuka na mimi pale bwana. Ndio mtoto yako yakufuate.
Wewe umeitumwa pesa na mwanaume, ndio unakula anatuma tena. Haulizi? Unakula anatuma tena. Kuna shida na hiyo?
Huyu mzee hakuna mtu anatopokanga
na wewe mzee. Hii tabia watu kula fea. Ishawahi kutokea.
Si ndio?
Wanacheza pale. Mia yangu nilikuliwa 50 pop. Nilisikia uchungu mbaya sana pale.
50 pop nao pesa ngapi?